Good morning, everybody. So thank you, Ludger, for the introduction, very generous introduction. I think you mentioned the research group, the ULB, the Free University of Brussels research group I'm affiliated to, but I'm affiliated in Liège to the Center for Ethnic and Migration Studies, the CEDEM, but never mind, it's not a big issue. And I work now in a new research center at Guildhall School in London, but I'm still affiliated to CEDEM and doing research there. I've been doing for 7-8 years research in CEDEM, and I hope I will continue this relationship with Marco and the research group there. So thank you for the introduction. Thank you for organizing this. I just have to mention that I was supposed to present with Marco Martiniello today, but he couldn't make it. So probably my presentation will be a little bit shorter than the others you've had, but it's not a big issue. We can have a coffee break earlier. So very briefly, what I want to outline today is a few points we worked on, me and Marco, in a piece we published on the conversation in early April, so full COVID emergency and lockdown. I think lockdown not everywhere, but in some of those countries which experienced the spread of the virus earlier. They were already locked down, like Spain or Italy, for example. So our idea was to reason a little bit on the impact of COVID on particularly on the refugee question in the broad sense. So something that was happening in that moment, but also trying to give sort of a prediction on what the problems and the impact could have been in the following weeks and months as well. So our idea was to consider two different dimensions to address this question. So the discourses and practices, as often happens in sociology of migration. And we try to sum up what was going on both in the political debate and in terms of civil society, in the civil society. That's because as you mentioned, we have been involved until the end of 2019 in a research about public opinion and forms of mobilization concerning refugees in Europe. We worked in Germany, Belgium, Sweden, Italy, Greece, and Hungary. That was the 6 case studies. And we focused on particularly on what we have called the reception crisis, not the refugee crisis. We tried to change this label because our point has been to remark that between 2015 and 2018, there's been a reception crisis of reception structures, crisis of governance, and of course an increase in the arrival of asylum seekers, but we prefer to look at what was going on in terms of the capacity to receive those big waves, big new waves of asylum seekers. So what's concerning the article we wrote in April. What we put first in the article was this idea of shifting priorities, and these in both concerning the political context and the civil society context. In political terms, we saw shifting in the agenda and also in the debates. Let's say that those topic trends we had before, migration and refugees in particular, became a little bit less popular in the debates and were replaced by the emergency, the COVID emergency. So migration took a back seat in the first moment, and at least as an issue to be addressed, criticized, employed in the propaganda, and eventually solved, although that was not really the perspective of many governments during the reception crisis, at least. However, we noticed some let's say, manipulation, some use or misuse of the COVID emergency, and in a kind of in a way that it was articulated as something sort of in somehow linked to migration, and that's the case of course, Viktor Orban, who blamed foreigners for the spread of COVID in Hungary, which was extremely limited at the time. Then the things changed, but at the time Hungary was one of the safest countries in Europe, let's say, in terms of contagion. Or, for example, also Donald Trump, who was seen several times speaking of a foreign virus, Chinese virus, so framing the emergency as something somehow linked to the movement of people. And another interesting case we mentioned in the article is the case of a journalist, an Italian journalist, mainstream Italian journalist, one of the most powerful in terms of leading the public opinions. Bruno Vespa is an old journalist. He has a live show on the national broadcast going on for 30 years. Is a big name of the public sphere in Italy. And the first thing he did when everything started was to point out that emergency, that's just his opinion, not my opinion, of course, emergency, that the NGO was not doing anything for COVID, which was completely untrue, because they were active in supporting the hospital staff and doctors during the pandemic pretty much everywhere in Italy. And he said, okay, you do all what you do for migrants and you don't do anything, you don't make a move for us when there's a big emergency. So just to say that even in mainstream journalism, and not only from those quite extreme and anti-migration politicians, there was this like using a little bit, being ambiguous between the use in the use of the COVID element in the public debate connected to the migration element. Well, politically, we tried also a little bit to sketch out very briefly what was going on in terms of measures taken on migration during the pandemic. And the general thing that can be said is that governments started increase their attention on the border control. So we saw this closing in of countries increasingly intensifying and involving not just, for example, in Europe, external migrants, so non-EU migrants, but also people from countries within the Union, and in some cases, like in Italy, for example, but also in Austria or in other countries, we saw internal borders between regions being reinforced. Migration-wise, and in particular on the refugee question, we saw countries trying to reduce, as usual, or even to stop stop refugees coming to the country, and these in a way that is the way that they always decide to take. So stopping asylum applications, which is something that may work on the bureaucratic level, but it obviously doesn't work on the practical level. So Germany, for example, but also Belgium stopped asylum applications for an indefinite period of time. This until the pandemic was taking too long. So a big issue for countries, for example, like Italy or Spain, came up. The lack of workforce in some sectors, like, for example, the agricultural sectors. So we saw some idea in the debate, some insights to grant temporary visas to those migrants involved in the sector. So let's say that during COVID, we saw the same trends we normally see in the refugee issue politically, being concentrated in short time and being let's say exposed to a more evident dimension. So a little bit a mirror function empowered by the pandemic. So the second axis we have taken, so the one concerning practices, is something we addressed mostly, if not completely, on the dimension of the civil society, as there was a big impact of COVID, and especially of the measures to fight COVID on the activity of the civil society and the involvement of people in the refugee question. And this has showed, if any more demonstration was needed, that the reception system is still extremely fragile, because it is based on the involvement of actors that operate in an informal environment most of the times, except for the cases where civil society was able to constitute organizations. And still, in that case, we see a very precarious context, precarious way to operate for those people and activists and collectives and organizations involved in very important activities for the reception and integration of asylum seekers. In our research, so the book that was mentioned before by Ludger is pretty much focused on this. We kind of tried to tell something about these movements that started in 2015, and some were already there and just changed their perspective of action. But we basically highlighted the fact that we are not just talking about first aid or a solidarity perspective, but we talk about concrete role in the reception of asylum seekers. I personally focused on the Belgian context, so I can say that the collectives, the organizations, and we have collected data on different organizations. For example, Brussels Refugees is one of the probably most famous. They were part of the reception network. They were considered by those institutional actors. In Belgium, we have two main actors: the federal Department for Asylum, which is the acronym is FEDASIL, and its main partner is the Red Cross. Talking about collective reception centers, this is something that needs to be probably said. They considered and still considered activists and groups, organizations from the civil society as an integral part of the network. They do activities with them, and they know that they wouldn't be able to provide many services to the migrants without the help, without the integration, the substantial role of civil society organizations. And we also looked at outside reception centers, in those sites characterized by the concentration of migrants, but without any structures. In Belgium, what's quite famous, the case of the North Station, Brussels North Station, where there was a big concentration, but there are many cases in Europe, from Calais to the Malmö station and many other cases. So we looked at those places where civil society organizations were even more important, because no institutional support is provided. So almost everything is on the shoulders of the civil society actors there. So going back to my topic and the article, so what we have noticed, of course, is a stop, a halt, an interruption of many services and activities due to confinement and social distancing measures. On one hand, we saw a different kind of mobilization, or better, similar mobilization, but concentrated on the question of the regularization of irregular migrants. So activists who couldn't actually help materially, they started to mobilize for asking governments to regularize irregular migrants. And in some cases, this worked. Like, for example, in Portugal, where there was a temporary regularization granted to all undocumented migrants. But as I said, practices had to stop. And for the first reason was that reception centers, collective reception centers, but also individual structures closed completely to the outside. So the activists, but I call them activists, but we can call them workers or facilitators or any other identification of a person working, helping in a specific sector, which is the one of the reception of asylum seekers. So those people couldn't get into the structures, so they couldn't basically do anything. And this because they are not recognized, officially recognized as an element, an integral part of the reception center itself. While, for example, Red Cross operator, Red Cross people or Federal people are recognized as such. So we saw basically three different cases that can sort of give us the specific idea of what the impact of COVID-19 was on practices of the civil society. So firstly, they stopped. Secondly, practices were transformed and started to be conducted in alternative sites. So in those cases where, for example, the informal sites I've been mentioning before, the North Station, those cases where there was no structure to control the movement of people, the forms of solidarity shifted in terms of the site where these were happening. And we have had many cases of people organizing in private spaces, the reception, and giving support to refugees privately in their homes, or squatting places, or even asking like small companies to give them the space they didn't use during the emergency for setting up a site of reception. And then we saw a third trend, which was probably the most, I don't have data, so I cannot say the most evident or the most, the one which was mostly taken by activists and the civil society organization. But it was probably the most visible, and when I say visible, I don't talk about mainstream information, of course, but mostly those channels and networks that are used by civil society organization, including social media. So what was really interesting was to see a change in the let's say target group of the activity of the civil society organizations. More than change, I would say a broadening of the target group. So if many organizations were conceived for taking care of the refugee question, during COVID, they changed, they broadened their action and going towards social aid in general. for the population, the generalized population, including refugees and asylum seekers, but not just limited to them. So we saw food chains, we saw even the production of masks, for example, was something that was really, really interesting to see how many groups which were before involved in reception of asylum seekers started to mobilize and to be active in the production of masks, private production, handmade production of masks, or in the provision of food for those who couldn't work, those people who couldn't have a salary. So they sort of transformed their activities. So we liked to see this as a shifting in priorities, in the positive sense, of course, compared to the shifting in priorities with of the political and the governmental context. And one last point we addressed in the article, and with this I conclude my short presentation, was an increase of collective fear, social fear, and this was something that at the time, but still now, is fueling xenophobia, of course. In Greece, it started in Greece, and we need to mention that when COVID started, so talking about the end of February in Europe, we had very tense relationships between Greece and Turkey, and migrants continued to overload the hotspots, the so-called hotspots on the Greek islands, and in areas where before there have been many examples of solidarity from the population in the Greek islands, we started to see strong change, with an evident change in the public opinion. People started to protest against hotspots in a way that was probably not the same way we saw the extreme right protesting. But then we also, remarked that many groups, many far-right groups from Germany, from Hungary, from Austria, even from Italy, going to Greece and kind of pushing up, fueling the protest, and with the really instrumental approach, and so to detriment, of course, of social engagement and solidarity in those spaces. And it was quite clear how right-wing arguments could take advantage of the radical shift in priorities of that was happening, because between the political sphere and the civil society, you have the public opinion. So it's been, in the beginning of the crisis, a very hard time, and still now there's in some countries especially, and here I talk about Italy, for example, there's a strong idea of controlling the way citizens are respecting or not the social distancing or confinement or any other measures decided to fight COVID. So this shifting of priorities sometimes has created social hierarchy, has reinforced social hierarchies. So we were kind of worried about, in the article, about the fact this could the situation of stress, anxiety, isolation could be even, could increase the reactions, could make them worse in terms of how people could react to the violation of the confinement measures if done by a migrant. We say that any violation to anti-contagion rule would be seen as unacceptable if done by, even more if done by migrants. And any concession, any any special measure taken by the governments for helping or giving support to migrants would have been seen as a privilege to the detriment of national security. So hostile reactions were just outside our door. So we were kind of thinking about this form of nationalistic egoism that could be, could grow with COVID emergency and the pandemic. So all those slogans like, Britain first, La France d'abord, or Prima gli Italiani, could become even stronger in the public opinion. So it's, I think that's pretty much all. It's 10:30, so I'm, happy about my timing. So thank you for.
Okay. Thank you very much, Alessandro. I think this was very, very updated and interesting, and at the same time connecting to the study you already did and published and submitted to us. And many of the master course students read the first chapter of your book that you sent us. Because I understood that it's mainly filling a gap in much of migration studies that only focus on the individual level of migration trajectories or destinies, etc., or on the governance structures at the national and macro level. And you try to combine and to introduce systematically civil society activities, public discourse, and social practices. So I think this is very timely and very, very innovative to a certain extent in migration studies. Do you have, well, I would like, perhaps we ask all the students to put questions and comments, and then if there's time, I also would have one question.